eye conditions. The following are some of the common causes of vision loss. Macular degeneration, commonly referred to as MD, affects central vision, which is very good at seeing fine detail and colour in bright lighting conditions. A person with MD will usually notice that they have a blurred or distorted patch in the middle of their vision. They may notice that straight edges, such as window frames, have a wobble or kink. As the disease becomes more advanced, the central vision may be missing altogether. A black blob or scotoma develops. People usually have had a lifetime of seeing well and are in the habit of looking straight at the object they want to see. With MD, when the person looks straight at their friend's face, for example, they place the scotoma on top of what they want to see, and it disappears from view, which is very frustrating. With practice, some people find it is helpful to look slightly away from the object they're looking at. For example, looking to the side of a face means they can see their friend smiling. This is because their peripheral vision is still working. Peripheral vision does not see in fine detail or colour, but is very good in low lighting and at picking up movement. Sometimes this is confusing for the person and their family. They may be able to see a fly buzzing round in the peripheral vision, but when the fly lands and they look straight at it, it is impossible to see. Glare can be a problem for people with MD, and the person may find that it takes longer to adjust when moving from bright to dim lighting, and vice versa. MD becomes more likely as a person ages and the cells in the macula become damaged and worn out, known as age-related macular degeneration or AMD. There are effective treatments for some types of AMD. MD that is not age-related is most commonly caused by an inherited condition. These forms are sometimes called juvenile macular degeneration. Glaucoma is the name given to a group of related diseases where the optic nerve is being damaged. Glaucoma is sometimes called the sneak thief of sight. For many people, patches of vision may be lost in the peripheral vision. This may go unnoticed, especially if bits missing in one eye are seen by the other eye. Also, our brain is very good at filling in missing patches to fit in with the general picture. This means a person with early vision loss from glaucoma may not know there's anything wrong. They think they see the whole picture, but may be missing important information. For example, not seeing a car at the edge of the vision when crossing a road. Typically in glaucoma, a person loses vision either above or below the horizontal midline, so they may trip on steps or curbs or knock their head on overhanging branches. Often central reading and colour vision may be preserved, however contrast may be lost. This means that the person may not be able to see a dark pen on a grey table or distinguish steps from shadows. The ability to adjust effectively to lower lighting conditions is reduced, and glare often a problem. It is important that everyone has a check at age 45 and repeat once every 5 years to catch any developing disease before significant damage is done. Diabetic retinopathy is the condition caused by damage to your retina through diabetes. Diabetic eye disease can lead to blurred, patchy vision, which varies from day to day. Both fine detailed central vision and peripheral vision may be reduced. The ability to adjust to changing lighting conditions can be affected. People with diabetes are also more at risk of developing cataracts and glaucoma. Having diabetes does not necessarily lead to sight loss. If caught early, diabetic eye disease is usually treatable with drug, laser, or surgical interventions. Its progress can be slowed through your own interventions, such as managing your diet and blood pressure. If not identified and treated, it can, however, lead to significant vision loss and even blindness. Cataracts are cloudy areas in the lens of the eye, and most cataracts are associated with getting older. The clear lens inside the eye gradually becomes misty. If a cataract develops so that it stops light entering the eye, it can usually be removed by surgery and a clear artificial lens placed inside the eye. Cataracts often cause blurriness and loss of fine detail. Glare is often very troublesome, even in early cataract, when a person can still see to read and drive a car. They may find that they cannot see well at dusk and need to stop driving at night due to lights appearing distorted or doubled. Retinitis pigmentosa, commonly referred to as RP, describes several different hereditary diseases. With RP, vision loss is caused by the breakdown and loss of cells in the retina. The different types of RP lead to different functional vision difficulties. Most commonly, at first there is trouble with seeing in low lighting. It can be hard for a young person to explain to their friends that they manage well in the daytime but cannot see to move around safely at night. Peripheral vision loss, with loss of contrast and night vision, often happens first, though some types of RP begin with reduction in central, fine detail vision. Glare may also be an issue. It's very important for the person to understand how the disease affects them as an individual so they can make adjustments and learn strategies. As with all types of vision impairment, people with RP often find that their useful vision varies depending on the environment, where they are, and what they're doing. It may be easy to use their vision to cross the road on a bright sunny Sunday afternoon, but much more difficult at 6 p.m. on a rainy evening when everyone is rushing home from work. Many people live with more than one eye condition, especially as they get older. Everyone's experience of vision loss is individual and can be affected by how they're feeling and their general health. Managing lighting is important to avoid glare while maximizing functional vision. To learn more about any of these eye conditions, visit the Blind Foundation website for links to other organizations.